I'm talking today about a DFE funded study called Family Roots. As It's a study that is longitudinal and it's still in progress. It doesn't finish till 2028. So these are still some of the interim findings, and the focus really is on young people aged 12 to 25, because although we know quite a lot about younger children, we know far less about the adolescent years and the transition from adolescence into emerging adulthood. So just to say a little bit for those unfamiliar with children in care in England, at the end of March 2025, we had about 81,000 children in our care system. The vast majority were placed with foster carers, so family-based foster carers, and most were in care because of abuse and neglect. And the aim for all children growing up in care is that they have a stable, secure environment where they can develop strong relationships, a sense of identity and feelings of belonging. And this aim is translated for social workers into something called permanency planning. And the type of placements that social workers aim for is, first of all, to aim for a return to birth parents. So whenever possible, social workers aim to return a child to the birth family, and that's called reunification. When that's not possible, this is in no particular order because it depends on what's in the best interests of the child. But then consideration is thought about placing a child for adoption, or placing a child with other members of the birth family, with relatives, and placing a child on a special guardianship order. And for children where none of those things are possible, thinking about long-term foster care. And this is where a child remains with a foster carer on a long-term permanent basis, but where the local authority retains responsibility for the child's care planning. So the Family Roots study is a mixed method study, and it's led by Emeritus, and there are three elements to it. The recenter, and this is the bit I'm going to be talking about today, is using administrative data, and it's using data from looked after children and adopted, given to us by the Department for Education. And it's a bespoke data set, national pupil database. And I should also say we also have children in need data, outcome data from looked after children, data on exclusions and absences, individualized learner records, which is the records from further education, a data set called the Young Persons Matched Administrative Data Set, and also data on university entrances. In total, we had 10 different data sets which have been linked and analysed in the ONS SRS. The bit that's being worked on by Emeritus are qualitative interviews, and they're being done with young people and families in adoption and special guardianship orders. Ipsos have also done online surveys, and they've been done with parents and carers of adopted and young people, and of two different age groups, young people aged 12 to 17, and then the older age group 18 to 25. But for the administrative analysis, which is today what I'm really focusing on, is what were the long-term educational outcomes for children who left care, and what was the stability of the different placements and the trajectories of children. And today's presentation is only on the findings related to long-term foster care. And so we're going to consider today what were the long-term educational outcomes for children in long-term foster care, and how did they compare with their peers who were not in care? What were the risk and protective factors that might explain those differences? And how stable were the placements? And how did that stability affect their educational outcomes? And the study findings, I've given the link below, and there's a study website available by that link containing lots of information about the project. And as the project continues, there will be more and more publications that are available through that link. I just want to say a little bit about what we mean by long-term foster care. Because although long-term foster care has been used for decades, it's only been legally defined by a specific set of criteria since 2015. And those specific sets of criteria are several things. First of all, it's got to have been agreed by the local authority, and it's got to be set out and written in the child's case file. It's got to be defined there in the child's case file. The independent reviewing officer who oversees the child's care reviews has had to be involved in that decision. The birth parents and the foster carer has had to be officially notified of the decision, and the child has to be notified if they're old enough. And of course, the carer has to have agreed to that decision. And once all that's happened, 2 new codes are placed on the placement type in the admin data sets. So there's a U1 code, which means that a long-term fostering decision is made that the child is going to be placed with a relative or a friend, or a U2 code, which means they're placed with a matched and unrelated carer. And the idea of this long-term foster care decision is that the child is going to find some kind of permanence within the care system, that they're going to grow up in care with a foster carer who is going to provide them with that stability, long-term relationship where children are going to feel that sense of stability and belonging. But when we looked at the data, we found some data limitations. Firstly, that U code had been used in some rather strange ways. It had been used in ways, so we found that children had been given a U code, and then within a few months they'd left on a special guardianship order. So although the code was intended to imply that they might have been living with the same carer, they certainly weren't going to grow up in care with that carer. The code had also been given almost the same day that the child had entered care. So those processes that were intended to happen of discussions, the parent being informed, couldn't have happened within that timescale. There is also no date in the admin data sets showing when that decision had been made. So it gave us some difficulty about knowing how to identify placement stability. We didn't know whether the U code was stating that this placement was the one that was intended to be the stable placement, or the placement was to be sought in the future. So we made a decision that one more placement was to be sought before counting placement stability. There was also no data on whether services were provided or interagency collaboration. So we didn't know what services were going into placements. And the use of other as a variable created lots of problems when it was used in many, many circumstances. So, for example, other was used in many, many circumstances for type of placement when children were older than 16. It was used as a reason when children were suspended. Other. It was used as a reason why qualifications were not completed when children were over 16. So this category of other can be really problematic. Data strengths, well, it was longitudinal and we were able to follow a complete cohort. So let's talk about the children in our sample. So our sample criteria was we had all the children who had a permanent long-term foster care decision in our admin data set. So they all had one of these U1 or U2 codes. They'd been selected based on they'd completed Key Stage 4. This is qualifications completed at age 15 and 16 when they complete their GCSE exams. Age 15 and 16, and they'd all completed them between the ages of 15 and 16, between the years 15 and 16 and 18 and 19. So these years were not affected by COVID. They'd all entered care before the age of 8, and they hadn't left care, so they'd grown up in care. They were born between the ages of 1999 and 2003. And 43% had summer birthdays. So these, I put that in because the summer birthdays mean that they were developmentally immature. And we were able to look back and examine their attainments and progress from Key Stage 1, when they were age 6, then look forward to when they were age 10, then to age 15 and 16, and then forward to age 19. So just to say a little bit about the sample, 57% were boys, which is fairly typical for children in care. There's always more boys than girls. There were also more white children in the sample than minority ethnic children. And this suggests that children who are having long-term foster care decisions are also more likely to be white than the minority ethnic children. And the same also happens in adoption and in other types of permanency planning, where white children seem to be prioritized more than minority ethnic children. Now, this is a multiple regression table looking at their Key Stage 1 average point scores. This is at age 6 to 7. I've highlighted in red what was statistically significant. Now, if you look at the coefficient scores, which is the B column, you can see that special educational needs, which is the bottom row highlighted in red, was the most statistically significant. So children who had a special educational need, a SEN, had scores 5 points lower than children who didn't have a SEN. Summer birthdays were also 1 point lower. Also statistically significant were children, white children were scoring lower, and children who were older at entry to care. And all the models, all the factors, when they were added together, showed that the adjusted residuals So then if we look at key stage 2, so this is when the children were aged 10 and 11. So here we can still see that special educational needs are still the most significant factor. So here they're still scoring 5 points lower, but coming into the most important factors here is being suspended during primary school. So again, 1 point lower. Summer birthdays are still significant. But coming in again now to being significant is being female. At key stage 1, sex wasn't significant. Being a boy or girl made no difference. But by key stage 2, boys were scoring lower than girls. And as we go through the ages, the gap between boys and girls gets wider and wider. And the adjusted R squared here is really high. It's 60% of the variance here is being explained by this model. And again, the gap between white children and minority ethnic children is again getting wider and wider. If we look at the descriptives, why some of, around those regression models. So at key stage 1, 53% of our long-term foster care children were meeting the standards in reading, writing and maths, compared with 90% of all pupils. So there was a very early attainment gap and educational disadvantage. So this is at age 6 and 7. So really early on, there was this early gap. At key stage 2, 55% met the standards, compared with 75% of all pupils. And it was English, especially the writing results, where the widest attainment gap was. If we look at the writing results, you can see that 40% of our long-term foster care children had attained the writing results, compared with 83% of all pupils. And that's a minus 38% attainment gap. It's a huge gap at key stage 2. So there was no gender gap at key stage 1. It was evident at key stage 2. And boys made less. Not only did they was the gender gap widening by key stage 2, but the progress scores between key stage 1 and key stage 2 were also widening. Children of all minority ethnicities did better than white children. So it wasn't just the Asian children, which you often see amongst all pupils. It was Black children, it was mixed ethnicity children, it was Asian children. All minority ethnic children were doing better than white children. At key stage 2, 68% of the long-term foster care children were receiving either special educational needs supports or they had an educational and health care plan, compared with 17 to 20% of pupils between our years. So there was a huge difference in the amount of special education, in the extent of special educational needs in our sample. Persistent absenteeism was high in our long-term foster care children in primary school. And boys were more frequently suspended than girls. But it's also important to say that 15% of our sample were doing well. They were exceeding standards in reading, writing and maths at the end of key stage. Performing poorly. Something keeps happening to my slides. Now this is key stage 4, and this is a logistic regression, and it's asking who got level 2. Level 2 is 5 GCSEs at grades 9 to 4, and it's only looking at children without a special educational need because so few children reach this threshold. I'll talk about the main SEN types in a minute. I'll do that at the end. Persistently absent, as you can see, is statistically significant. And as you can see, what was the most significant was actually having reached key stage 2. So having attained key stage 2 was the most significant predictor of getting key stage 4 level 2. So if you'd managed to attain key stage 2, that was the most significant predictor for getting level 2 at key stage 4. The number of placement changes also had a significant impact on how you did at key stage 4. Key stage 4 is at age 15, 16. Remember, these children were meant to stay in their placement, but as I'll explain later, many of them were changing placement. Ethnicity, again, white children continued to do poorly, boys continued to do poorly, and being absent in secondary school continued to have a negative effect. So at key stage 4, when children were aged 15, 16, attainment was low. 53% of the children had a special educational need. That's either receiving SEN support or had an educational health care plan, compared to 14% of pupils. And it was a really powerful predictor of low attainment, but it wasn't the whole story, because if you look at attainment 8 scores, attainment 8 is a scale score of the total score across 8 different types of eight different qualifications. English and maths is double weighted. The science and other types of qualifications all added together. So the total score is added together. So long-term foster care children without a SEN were minus 20 points below pupils who also didn't have a SEN. So that's a big attainment gap. So special educational needs were not the whole explanation. The gender gap I should say that children with a SEN, with a special educational need, had a much smaller attainment gap. It was only minus 8 points, 8.5 gaps, compared with children with a special educational need. The gender gap had widened across the years. Boys were doing much, much poorer than girls. 17% were persistently absent, and 27% had been suspended at least once in secondary school. That level 2 threshold had been achieved by 39% of children in long-term foster care without a special educational need, and 12% of those with a SEN, compared to 55% of all pupils. And this is really concerning. Only 11% had passed English and maths, compared to 43% of all pupils, but slightly more than 7% of all children in care. English and maths were very low. Placement stability. Remember that these children were meant to have been in a placement that was meant to be permanent. 51% had remained in their permanent placement up to the age of 16. 35% had had 2 to 4 placement changes, and 14% had had 5 or more. Some had 17 placement changes. It was a strong predictor of educational attainment. It was not associated with special educational needs, but with how long they'd been in care. So this just shows you the number of carers and placement changes and the effect on attainment at Key Stage 4. So level 1 is any grade really, grade 1 to 9. And you can see here that if they'd had if they'd had no change, just one carer, 79% managed to get some qualifications. With 2 or 4 carers, changes just over half at 56% had gone down, and you can see it drops to 3 is 2 or more A levels. And you can see here that only 7% managed to achieve 2 or more A levels if they'd had 3 or more carers, 5 or more carers, sorry. Now, if we look at post-16, post-16 descriptors is quite interesting because most of the children, 85%, chose to enter further education. They didn't stay on at school. It was a really second chance for many. 63% were in staying put placements, not necessarily the same placement that they started with, because only 51% were in the same placement that they began with. 1 in 10 children were high achievers. This is important to say. They'd achieved 8+ GCSEs and 2 or more A levels. But you can see here that many were late achievers. 26% reached that level 2 when they were 13 to 16, but in further education, 22% got their level 2, and they continued to achieve it when they were aged 20 to 24, but they still hadn't got it by the end of our data collection. So 50% had not achieved it by the age of 24. English and maths is the really concerning statistic. 22% hadn't got it by the age of 16. In FE, 8% got it and continued to get it at age 20 to 24, another 1%. But the majority still hadn't attained English and maths. Level 3, which is 2 or more A levels, you can see that most were getting it between 17 and 19. But again, young people were still getting it between 20 to 24. And of course, young people may still continue to get it after our data collection ended. So it's important to say that attainment continued, but the majority were not getting it. Certainly level 2, which most young people in the general population are getting in school, nearly as many were getting post-16 as were getting in schools. So to summarise, there was early and persistent educational disadvantage. It was shaped by an interaction of special educational needs with that early attainment. Key Stage 2 really determined what happened at Key Stage 4. And those early results, particularly in English and English writing, that was determining what was happening at Key Stage 4. There's been so much emphasis on English reading and far less emphasis on English writing, which we may need to think about. Placement stability was having a really strong effect on attainment. Females were doing so much better than boys, and boys were really slipping behind. White children were performing really poorly compared with minority ethnic children. Attendance during primary school was not being picked up as well as it might, because attendance in primary school continued to be very poor in secondary school, as well as in primary. As you know, primary school attendance was poor, and it continued to be poor in secondary school. But the findings also demonstrate that outcomes weren't static, and neither were they universally negative, because we also saw in this sample that many children did well. At least 10% were performing very well. Thank you.